Okay, so thank you very much.
So Anna-Leena, you might want to just move me out of the way. Do you want to say me?
Yeah. All right. Yeah. So I will be talking about our risk perception monitoring process that we have been running here in THL since February 2020. The aim of this process was to understand the perceptions of the public towards various issues related to the pandemic. So this is a practical process that is based on collecting social media data, analyzing it, and then drafting risk communication recommendations on regular basis. So basically, it is a tool for risk communication for them to draft messages and content meaningfully during the pandemic. And before I move on, I would like also to acknowledge my colleagues, Katja Siebenberg and Suvi Hyökki, who have been very closely also working on this process. When we started to develop the process, there were certain steps that we had to think very carefully. We were thinking about this data retrieval system. We had to first think which are these channels that the public is communicating with us, what kind of social media channels they are using mostly, where the most beneficial information is coming from. We decided then to use the Facebook and some contents of info email boxes as a content for the process. We also had to think about how we want to analyze the data which is coming up. And because we really wanted to understand the public, so we thought of using qualitative analysis as a base for this process. And then we also had to think about recommendations. How do we draft our recommendations for that risk communication? And I think this links perhaps with the John's earlier question, asking what kind of framework for change or behavior change should we think or would be best. We did not take any specific framework for change for the drafting, but rather decided to apply very openly risk communication principles and behavior science principles on drafting the communication. Partly because we did not want to lock ourselves into certain framework, and also because the whole thing was new, and I think we were sitting and thinking similarly as also what would be the best framework. So that issue was left open. However, I believe that the more we carry out these frameworks and these processes, the more information we get out of this, and perhaps also at some point we are able to establish our own behavior change model based on this process. But at this point, it's really has been open discussions. And in our reporting and dissemination of the findings, we also included knowledge co-creation. So we wanted to have an opportunity to verify and reflect the analysis and as well as the risk communication recommendations before they come up in the final format as recommendations for the process. And if we think back, or if we think what this framework did as a change, is that before we had this monitoring process, the social media data, the information, the communications of the public were coming to us, and public health experts and risk communication experts used this information individually. So they created their own understanding and interpretations of the data and used it as such. And then at the moment, we are pulling this information together, we are analyzing it, and it comes out as one report. So definitely this type of information is now more readily available in the organization. It is probably much more used because it's easy to use if needed. And perhaps also to some extent, it has also unified the messaging that is coming out from our organization. Just as a principle, what was kind of driving this idea was really the need to develop context-specific communication. As I think we have also mentioned in several presentations, the need to understand the perceptions of health and illness and healthcare are very important when we want to really address the behaviors and the overall understanding and draft really meaningful communication. And these perceptions and ideas are also changing in time. So as we come along with the pandemic, of course, things are also changing. But some of these factors that are extremely important, I think, in this pandemic, we're talking about differences in risk-taking practices or physical distance taking, greetings, hygiene behaviors. When we talk normative rules, it's also very important to understand how the public is perceiving the instructions of the authorities, where we are talking about a trust, what kind of things are currently trending that are building the trust, what kind of factors we can see that are influencing the mistrust. Individualism and collectivism are also very important issues to be captured. What is really motivating currently the behavior? Are the current narratives looking into individual factors? People care about their own health, or are they perhaps discussing larger issues influencing the whole society? Are people interested in what is happening to the nation, or do they care more about their families? And overall motivation, as we all know, behaviors do not change or stay the same with this information and fatigue that we are, and you have been referring several times, of course, has a big role or is strongly related to the issues of motivation. What is motivating those different behaviors that we need to promote to the public? And the second overarching important issue that we also thought of when creating this framework was really to enhancing the understanding and acknowledging the fact that it's really not a very simple thing to communicate to the public when we talk about expert information transfer to the public that is usually looking into the understanding very differently than experts. Experts like to talk about the evidence, they like to talk about the data and information, whereas citizens are then thinking more and filtering this information through experiences and emotions. So somehow we also thought that having this kind of framework will also allow us to build this bridge between the health authority communications to the citizens and ensure that we have less misunderstandings along the line. Now, I'll give you a few examples. There are 3 examples actually that I have collected to show how this framework has practically worked. As I explained, we try to do it simple, and we have been trying to do it continuously. So at some point we had even a bi-monthly analysis. Lately, we have been doing them less, perhaps once a month, but depending really on the available resources. So this is one of the data analysis that showed us that people had a lot of questions how to manage their everyday life. What can they do when they go at work not to get infected with corona? Or what should they do when they take public transportation? And what is the best way to deal with when you are in a shop that is crowded? So it was clear that people had difficulties to apply these new information about social distancing in their everyday life. So we decided that we would need to develop or deliver provision of practical guidance for people how to prevent infection in everyday life. We came up with the application of a methodology for personal risk assessment that we decided to deliver through some social media influencers. So we created a webinar where we introduced this idea of personal risk. We asked these influencers to list all the risks that they had from the morning to the evening in their lives. And then we asked them join the brainstorm how they can reduce those risks. So, for example, if they felt like buying groceries was a very big risk factor, they could, for example, think of getting the groceries delivered online. Or if they thought that using elevator every day was a risk factor, then perhaps the suggestion was to use the elevator and so on. And after this exercise, we also encouraged them to share the same framework and the same methodology with the followers and requested them to carry on the same system among them. The second data example that I have here was about the Datum, where people were really wondering if it mattered what they were doing. There were a lot of questions and a lot of questioning, like where is the real evidence that, for example, mask use is effective, or why should I actually, you know, refrain meeting my friends? Is it really going to be a big deal if I do that? So there was a clear disbelief regarding the effectiveness of these measures. We decided that there is a need to concretize the transmission change to actually show how easily this virus can transmit and how effective it is actually in that case to do what authorities are asking them to do. So we created a real story, or it's a real virus transmission story that we displayed on the video clip, and which was then distributed through our social media channels. My third example is a data set where people looked into other people thinking that they are alone doing what they are doing, meaning I am using the mask, but my friends no longer use that. People go around and they don't care about social distancing measures anymore. I'm the only one who is doing it. And how does it help if there's nobody else following these rules? So kind of the feeling people felt being alone, and they thought that there is no one else anymore doing the things, that these behaviors are no longer a norm in a society. The positive thing about this data was that it showed that the idea of each individual and the behavior of each individual matters was very positive, because many of the campaigns in Finland have been stressing strongly the importance of the behavior of each individual. But now there was a clear need to emphasize the fact that people were still doing this. And this is actually very similar to the campaign that Wales had been doing also earlier, meaning bringing positive examples of role models actually on the table to show people that they were not alone, and also to bring positive messaging to emphasize and to manage to carry on a bit longer with all these restrictions. So those were basically the examples that I had about this process that we have been doing now over a year. And of course, we have many lessons that we have learned already. And definitely the process of developing this process is still in a process. So we are all the time learning and also improving it as we go along. What we have definitely learned is that we can use this kind of framework, and we can get very specific, context-specific and culturally appropriate recommendations out of it. And we also learned that the way we are doing it without any heavy structure, we don't have a working group that meets regularly or anything. So this lightness of this process has kept it alive, despite of the fact that everybody is extremely busy during pandemic, and not many people have a lot of time to hold on it. But it has been made as easy as possible, including also the dissemination of the research findings that is usually come through a PowerPoint, which is as short and as point to as possible, and also with some Teams-based meetings that people can join if they have a time and interest. What we have, however, also learned is that the process requires time and resources. So to do such a process, there has to be someone who can, for example, analyze qualitative data. There also has to be people who understand some basics of behavioral sciences and risk communication. And it is also, in the end of the day, quite labor intensive. So some automation might actually increase and make this process even better. We all know that the idea that we think is very beneficial, reflecting the findings, is still quite limited because people are busy. And also, we don't know exactly how much and how these findings are used in the reality, because we don't have any real monitoring system currently in place. So we learn on ad hoc basis how the results are used. So those perhaps some of the ideas that we still want to continue working and developing in the future. And we are also at this moment planning to expand the very same methodology and introduce it to some other entities. We're going to build some capacity building framework to capacity building workshops to carry out and let other entities to benefit from this as well in Finland. So thank you.
Wonderful. Thank you so much, Anna-Leena. That was a really great and really interesting presentation with lots of great insights. I was particularly, captured by that approach to asking influencers to think about the risks that they identify, from morning, day, afternoon, and evening. I think that's a really smart approach in terms of, getting younger people and influencers to think about those various points throughout the day. So it's not just tackling one behavior at a time, it's getting them to think about, the constant, not in a kind of a scary way, but the constant kind of risks that are around them, and being able to identify that is a really important part of changing behavior. How were you able to kind of, tailor some communications from some of those specific insights?
I don't think we have done, but I might be also wrong. We haven't really used the risk perception framework for further refine any messages. I mean, it was really, I think the overall idea is that we can never get rid of all the risks that we have, but we can try to minimize them. And we all have our own context, and we can, what we can do is we can do in our own context. And I think it was like kind of a wake up and think what I can do really in my own everyday life.
Yeah, that's really great. Any other questions? Feel free to drop them in the chat or just raise your hands. So Leah's put something in there. Can you talk to us a bit more about the interconnected process? Your slide showing data through to message development was really helpful. Something we've been trying to do and gain buy-in to in Wales as well.
Okay, so I think the interconnected, what you mean is the way that we are drafting the risk communication messages coming out of the data. Is that correct? I assume this is the question.
Yes, and also just how you got your teams, like, is that the way that your teams were already working, going from data collection through to analysis, coming up with the concept that needed to be addressed, then through to messaging, or did you have to create that through the pandemic, the ways of working?
Yeah, no, there wasn't such a project before. So basically people, experts from the organization that are already working actually in the risk communication joined these efforts to do the work. We actually have published this methodology in Eurosurveillance last year. So you can actually also find more insights to the actual methodology, how we were doing it. But as I was trying to explain earlier, the drafting of the messages is really based on basic brainstorming, basic risk communication principles, and some basics for behavioral sciences. So we don't have this behavior change framework that we would be directly using to come up with these recommendations. But as I said, I think we hope to come up perhaps with some kind of actual conceptual framework at some point. The more we do, the more we get insights into it. The qualitative data collection then was based on a thematic frame analysis. So we have a rapid thematic analysis that we are conducting using NVivo software to analyze them. So I hope that answered my questions.
Yeah, absolutely. I also I love how you described how you made it a really light, agile process rather than putting a lot of, big program governance around it. It was more about, getting things done. And also, I love the idea of having your data outputs and your findings consolidated into a very concise kind of PowerPoint type message, because sometimes it's really hard for those of us who are not researchers to distill what we need to know from a long report, and it's part of what we do, but it's helpful, so thank you.
Great. Thank you so much, Anna-Leena. I really appreciate you taking the time to present that to us. So we're now going into the final presentation.